Welcome to the Deep Dive, where we cut through the noise to get you truly well-informed with surprising facts and hopefully just enough humor to keep you hooked.
That's the plan.
Today, we're plunging into the really fascinating world of health information management, or HIM.
Right, him.
In this age of, rapid digital transformation, understanding how our health information is collected, stored, and used isn't just critical.
No, it's absolutely foundational. Foundational to the future of healthcare, really.
Exactly. So our mission for this deep dive is to give you a shortcut to understanding this essential field. We want to highlight the most important insights and uncover some aha moments about its past, present, and future.
And we're drawing from a pretty hefty source for this one.
We are. It's a single bibliometric study, but it's incredibly comprehensive. It meticulously analyzed 630 academic publications.
630, wow.
Yeah, from the last 40 years of HIM literature. So it gives us this amazing, holistic, bird's-eye view of the entire field.
Okay, so a real deep dive then.
Definitely. So let's unpack what's truly shaping the management of health information that impacts all of us.
Let's do it. Where do we start?
Well, first off, when we talk about this field, what the study unearths is just how expansive and, frankly, incredibly active HIM research really is.
Okay.
Imagine this: 630 documents published between 1983 and 2023.
Right, you mentioned that.
And coming from a whopping 281 different sources.
That's a lot of outlets.
But here's where it gets really interesting. The annual growth rate is an impressive 11.78%.
11.78% annually.
Annually. Think about what that means. It's a sustained, rapid increase in interest and investment in how health data is managed.
That's huge growth. And citations.
Good question. On average, each publication gets over 11 citations.
Okay, so it's impactful research. People are reading it, using it.
Exactly. It shows these papers are highly influential, actively shaping the scientific community's understanding. And get this, the average document age is just 5.26 years.
Wow, only 5 years. So this field is constantly being updated almost in real time.
Pretty much, it's moving fast.
What's truly fascinating about this growth, though, is how deeply collaborative these HIM studies are.
Ah, right. That stood out.
Yeah, the research found contributions from, wait for it, 2,546 authors.
2,500.
Yep, and only a tiny fraction, just 42, were single-author documents.
So almost everything is a team effort.
Overwhelmingly. On average, each piece of research has nearly 5 authors. 4.7 to be precise.
And wasn't there an international element, too?
Yes, a big one. Close to a quarter of all collaborations, 23.49% exactly, are international. If you connect this to the bigger picture, it really underscores that health information management isn't just a national concern.
It's global.
It's a global effort to tackle complex, universal healthcare challenges. That kind of shared problem solving is just, well, it's crucial in a field that touches literally everyone.
That global collaboration makes so much sense, especially when you think about shared health challenges across borders, like pandemics. And looking at the timeline the study laid out, it's clear HIM wasn't always this bustling field.
Right, it had a slow start.
Very slow. Between 1983 and 1993, interest was minimal. We're talking barely one publication a year on average.
One a year?
But then things shifted dramatically. The number of publications really surged starting around 2012.
Okay, so the last decade or so has been key.
Absolutely. And it actually peaked in the last 2 years covered by the study. We also saw citation numbers spike, interestingly, in 2006 and again in 2017.
Suggesting periods of particularly high-impact research then.
Precisely. This whole upward trajectory isn't just a trend. It strongly signals the increasing, undeniable relevance of HIM in our current healthcare landscape.
It mirrors what we see, right? Think about how much your own doctor's office or healthcare provider has digitized just in the last 10, 15 years.
Totally. This research surge reflects exactly that kind of rapid transformation we're all experiencing.
So that sets the stage. What about the content? What are the big themes?
Okay, so when we dig into the most cited papers in HIM, certain powerful themes consistently emerge. These have truly shaped the field.
And these aren't just academic curiosities, right? They point to real-world issues.
Exactly. They point directly to the core issues impacting healthcare for all of us. Take technological integration and innovation, for instance.
Okay.
Papers like Mandel et al.'s 2016 work on SMART on FHIR.
SMART on FHIR, right. Heard of that. FHIR is Fast Healthcare Interoperability Resources.
That's the one. Their work highlights the critical need for seamless integration of medical applications across different health information systems, or HISs.
So making different health software talk to each other easily.
Basically, yeah.
All right.
To put it simply, imagine like an app store for your health data, where different medical apps can kind of plug and play and communicate effectively to manage patient information more efficiently.
That makes sense. Interoperability is a huge challenge.
It is. Or look at Kramer et al.'s 2017 study on fog computing in healthcare.
Fog computing. Like cloud, but closer.
Kind of. It explored how this technology, by distributing processing closer to where data is actually generated, could help balance privacy and reliability concerns across various network layers.
Ah, so processing data locally before sending it off, maybe anonymizing it?
Something like that. It's all about getting the right data to the right place securely and quickly. Faster response, potentially better privacy.
Okay, interesting tech angles. But HIM isn't just tech, is it?
Not at all. And this brings us to a really crucial, often overlooked area, patient-centric challenges, and what one study calls the invisible work of managing health.
Invisible work. Tell me more. This sounds personal.
It really is. This is where it gets really personal for the listener, I think. Kim et al.'s 2009 study pointed out significant hurdles in getting electronic personal health records, PHRs, to low-income elderly populations.
Okay, what kind of hurdles?
Things like limited tech access, obviously, but also inadequate comprehension how to use them.
Right. The digital divide is real, especially for older or less affluent groups.
Exactly. And it raises this important question. How do we make sure these powerful systems actually serve those who stand to benefit the most, rather than just widening that divide?
That's a critical ethical question. And the invisible work.
Right, that concept itself was explored by Anchor et al. In 2015. It describes the countless tasks patients, especially those with chronic conditions, undertake to manage their own health information, tracking symptoms, appointments, medications.
Often without much formal support or recognition from the system.
Precisely. And furthermore, Moen et al.'s 2005 paper showed us how individuals and households develop their own strategies to organize the whole family's health information.
And probably often still relying on paper, binders, folders.
You guessed it.
Yeah.
Often still with paper-based tools. It just highlights the complex, often unacknowledged labor involved in managing health data right there in your home.
That invisible work concept is so powerful. It resonates because, yeah, many of us probably do bits of that every day without even labeling it as such.
Absolutely. Now, beyond those immediate patient challenges, other foundational concepts and standards have been absolutely crucial for the field.
Like what?
Well, Chin et al.'s 2013 research, for example, gave us the all aspects of health literacy scale.
Okay, a measurement tool.
Yeah, and it's not just a fancy name. It's a vital tool to measure the essential skills people need to understand and use health information effectively.
Which is crucial for both patients and providers, right? To make truly informed decisions together.
Exactly. Other studies also delved into the ongoing effort to bridge those digital divides, like Lustria et al., explored back in 2011.
Still relevant today.
Very. And the importance of standardizing mobile health apps, something Nori et al. Investigated in 2018, making sure they're reliable, safe, and can ideally work together.
Yeah, the app Wild West needs some fences. And underlying all of this has to be security, I assume.
Absolutely. Security and data integrity are paramount. Giacomotti et al.'s 2006 paper explored the potential of digital watermarking technology.
Watermarking, like on photos, but for data.
Kind of, yeah. As a potential solution for secure storage and distribution of medical data. Think of it like embedding a hidden, maybe imperceptible fingerprint within the data itself.
Interesting. To prove authenticity or track leaks.
Potentially both. This work, remember, it's from 2006, nearly 2 decades ago.
Wow. Ahead of its time.
It really underscores the ongoing critical need for robust security in HIM, especially as more and more sensitive information moves into digital formats and flies across networks.
It's all about building and maintaining trust in the system, isn't it?
It really is. Now, if we zoom out again for a second, look at the big picture of top contributor.
Where is all this research coming from?
Well, geographically, the USA stands out with the highest number of publications, at 199 in this data set.
Okay, leading the pack there.
And within the U.S., the University of Washington, Seattle is the most productive single institution mentioned.
UW. Okay. Makes sense. Strong informatics programs there.
And perhaps not surprisingly, the Health Information Management Journal leads in the raw count of articles published.
The dedicated journal for the field. Stands to reason.
So if you're looking for where the pulse of HIM research beats strongest, that gives you a pretty good map.
Useful context. Now, you mentioned earlier the study used some specific techniques to map the field.
Ah, yes, the science mapping. To truly understand hymn structure, the study employed techniques like co-occurrence and co-citation analysis.
Right. Oh, break those down for us. What do they actually show?
Okay, so think of it like this. Co-occurrence analysis looks at keywords that frequently appear together in documents.
So words that cluster together in the research papers.
Exactly. This helps us identify the current hot research themes, what people are actively working on and talking about right now.
Okay, the current landscape and co-citation.
Co-citation analysis is different. It examines which documents are cited together by other papers.
Ah, so if paper A and paper B are often mentioned in the same reference list.
It suggests they're seen as related, maybe part of the same school of thought or foundational to a specific topic. This helps identify the underlying intellectual foundations, the seminal papers, and core ideas that have shaped the field over time.
Got it. So one shows the current buzz, the other shows the intellectual roots, like seeing the leaves versus the branches and trunk.
That's a great analogy. So let's talk about those current research themes first, the ones from the co-occurrence analysis, the leaves.
Okay, what's buzzing right now?
The core, naturally, is health information management itself, data management, storage, analysis. But it branches into 5 critical sub-themes that really paint a vivid picture.
5 key areas. What are they?
First, electronic records. This is the digital backbone, right? Your EHRs, EMRs, enabling easy storage and sharing of patient information.
But the focus now is probably more on making them work better, more integrated.
Definitely. Improving interoperability is a huge part of that theme. Second, medical informatics.
The tech tools.
Right. The technological tools and methods that ensure prompt and precise decision-making in diagnosis and treatment. It's not just about computers. It's about smart algorithms, clinical decision support systems.
Using data intelligently to aid doctor.
Exactly. Third, e-health and telemedicine.
Very topical.
Hugely, covering digital platforms for delivering healthcare services, obviously vital during the pandemic, but increasingly important for rural access, chronic disease management, convenience.
It's here to stay.
Seems like it. Fourth, health education and awareness.
Educating whom? Patients. Providers.
Both, actually. Crucial for enhancing healthcare quality and patient safety for providers and the general population. Empowering people with knowledge about health and their data.
Makes sense. And the fifth?
And finally, health information systems, or HIS. This is the organizational bedrock.
The big systems hospitals use.
Yeah, managing everything from patient records and scheduling to billing and treatment plans. This theme really goes into the sheer complexity of implementing and integrating these vast systems within healthcare organizations.
Okay, those 5 cover a lot of ground.
They do. Then you also have personal health information as a distinct theme.
Focusing on the individual's perspective.
Exactly. Highlighting how individuals manage their own health information, often through those PHRs we mentioned earlier.
And connecting this to the bigger picture, this is vital for monitoring your own health.
And maybe more importantly, for facilitating truly effective communication with your providers, giving you the data to have better conversations.
Empowering the patient to be an active participant.
That's the goal. And finally, there's clinical coding and data quality.
Ah, the technical side, ICD-10 and all that.
Precisely. This is the precision work, but it's what makes the larger systems function accurately. It underpins reliable data collection.
Because if the coding is wrong, the data is wrong.
Right. Emphasizing the importance of international coding systems like ICD-10. And think about it. Accurate coding isn't just for billing.
No, it's crucial for tracking disease trends, public health surveillance, research, ensuring the right treatments.
And making sure patients receive high-quality, safe services overall. It's kind of the behind-the-scenes hero of good health data.
Okay, that covers the current themes. What about the intellectual foundations, the co-citation analysis, the trunk and branches?
Right. This reveals the deeper connections in the schools of thought that have really influenced the field over time. One key cluster is HIM and technology adoption.
So not just inventing tech, but getting people to use it.
Exactly. It emphasizes the critical role of technology acceptance, not just by organizations, but by the individuals, the patients, and the healthcare providers who actually interact with these systems daily.
Because if they don't use it or use it poorly, it doesn't matter how good the system is.
Precisely. Successful adoption of HIS and digital tools is paramount for actually improving patient safety, streamlining treatment procedures, and enhancing communication. Another related theme is health information system success.
How do we know if these systems are actually working?
That's what this theme digs into. How can we effectively measure and improve the effectiveness and success of these incredibly complex systems. It focuses on outcomes, not just ticking the box for implementation.
Measuring real impact. Makes sense.
Then there's a big one, the impact of EHRs and e-health technologies.
Okay, the payoff.
Yeah. This section clearly highlights how these technologies are actively improving healthcare quality, efficiency, and sometimes even reducing costs. It often links to concepts like meaningful use.
Meaningful use. For our listeners, that was a U.S. program incentivizing EHR adoption, but specifically using them in ways that demonstrably improved care, right?
Exactly. Making sure these digital tools are used in ways that genuinely improve patient care and public health outcomes, not just used as fancy digital filing cabinets.
Getting the most out of these powerful tools for better health.
That's the idea. And closely related is personal health information management, PHIM,
Yeah.
and consumer health informatics, CHI.
PHIM and CHI. Putting the patient or consumer front and center.
Definitely. This area underscores the significance of individuals actively managing their own health information, and how consumer health informatics, the tools and resources available directly to people, can empower them to access services, understand their health, and improve their overall healthcare experience.
Really putting the patient in the driver's seat of their own health journey.
Yes. And finally, the study identified a cluster around country health information systems framework and standards.
Taking it to the national and international level.
Exactly. This acknowledges the global effort, with organizations like the World Health Organization, the WHO, playing a key role in developing frameworks and standards for national HACEs.
To improve public health outcomes worldwide, ensure some consistency.
Precisely. So what does this all mean for you, the listener? You can really see how HIM isn't just some narrow technical field.
No, it's deeply intertwined with policy, human behavior, economics, ethics, global health.
It connects all these dots, all aiming for a healthier future.
Absolutely. So that covers the past and present structure. What about the future? Where is HIM headed?
Okay, the future. The study's multiple correspondence analysis, which is, a fancy way of saying they looked at how different terms relate to each other in the very latest research.
Mapping the emerging frontiers.
Kind of. It points to some incredibly exciting future directions. Terms like blockchain, artificial intelligence, and Internet of Things are showing up with high values.
The big tech buzzwords.
They are, but also significantly, the term data accuracy is right there with them.
Interesting pairing.
Yeah.
Cutting-edge tech needs solid data.
Exactly.
Yeah.
It indicates their increasing importance. This really suggests a future where technological innovation will play an even more significant role.
In areas like
Health data security, for one. Think blockchain for secure records,
Absolutely.
sophisticated analytics using AI, and ultimately improving the quality of patient care through smarter, more connected systems like IoT devices.
this whole discussion powerfully reinforces that HIM is just constantly evolving, isn't it?
Continuously. The growing prevalence of personalized healthcare, for example, means we need to seriously reevaluate how we manage the high-quality data generated by patients themselves.
Right. Data from wearables, from personal health apps, genetic data.
All of it. And with the constant, frankly scary news about data breaches, establishing secure data management systems isn't just important anymore.
It's absolutely paramount. Foundational for trust.
Paramount. Digital tools like EHRs will only become more vital for healthcare professionals to make truly informed treatment decisions in the future.
Which emphasizes the need for robust, reliable systems that can actually keep up with this accelerating pace of innovation.
And the research even lays out a kind of future research agenda. It poses specific questions to guide that innovation.
Oh, like what kind of questions?
Well, imagine exploring questions like, how can blockchain actually improve patient safety and the quality of health data? That's a huge one for security and trust.
Definitely. What else?
Or, what is the importance of user-friendly interfaces in HISs, and how can they best be designed? Because, as we said, usability is absolutely key to adoption and effectiveness.
If doctors and patients can't use it easily, it won't work.
Right. And one that truly resonates today. What are the ethical issues and ways to reduce data bias when analyzing health information using things like AI?
That's critical, ensuring equity and fairness as we rely more on algorithms.
They even delve into practical questions like, how do we assess the viability and scalability of these new blockchain-based HISs? Can they actually work in the real world at scale?
These questions really highlight the inherently multidisciplinary nature of future HIM work, don't they?
Totally. It's about combining that cutting-edge technology with crucial considerations for ethics, policy, human interaction, real-world applicability.
It's a field that's definitely always looking ahead.
So, wrapping up, we've taken a really comprehensive deep dive into health information management today,
Yeah, we covered a lot, from the rapid growth of the field and the most influential studies.
to the underlying conceptual structures, those current themes and intellectual foundations.
And looking ahead at those exciting, challenging future trends.
And what we've clearly seen is that HIM isn't just about technology, is it?
Not at all. It's a truly dynamic field that integrates technological innovation with socioeconomic factors, demographic shifts, cultural contexts. It's all interconnected.
It spans from the nitty-gritty details of clinical coding and data quality,
All the way to the personal management of health information right in our own homes,
and from national frameworks for health
to
systems.
global health initiatives. It really is a multidisciplinary approach.
And vital, ultimately, for improving the quality of healthcare and ensuring patient safety for everyone.
Absolutely.
Which raises an important final question for you, our listener, to maybe mull over as we wrap up. As this digital transformation continues to reshape healthcare, and as technologies like AI and blockchain become more prevalent, how might your own role evolve?
Yeah, how might you become more active in shaping and securing your own personal health information?
And will that invisible work of him that happens in the household today, will it become more visible, more recognized, maybe even more supported by the advanced systems of the future?
Something to think about.